Welcome to the deep dive. Today, we're tackling something pretty fundamental in healthcare.
Yeah, how do we actually know it's good and safe?
Exactly. Our mission here is to dig into the role of accreditation in making sure standards are high, not just generally, but also specifically in mental health facilities.
Which often get overlooked, right?
Right. We're pulling from, Joint Commission International, JCI,
The big global player.
NABH here in India, IASQA, Supreme Medic Consultancy, and also looking at discussions around improving mental health care quality itself.
It's interesting seeing all these different levels working together. You've got the international bodies like JCI and IASQA.
Setting broad standards.
Yeah, and then NABH focusing specifically on India, our context.
And Supreme Medic. They seem more hands-on.
Exactly. They help providers actually do the accreditation stuff. It paints a pretty full picture, this whole effort.
Okay, let's start with JCI then. They've been at it for, over 20 years?
Yeah, something like that. Active in loads of countries, over 70.
Wow. And accredited over 1,000 programs. Their mission is clear. Enable and affirm the highest standards of healthcare quality and patient safety for all.
It's a strong mission statement.
It makes you wonder, though, why are they so widely adopted globally? What's the key?
That's a good question. I think a big part of it is probably the perceived rigor. Their standards are seen as really comprehensive.
Based on international best practices.
Right. So if a hospital wants to show it meets a global benchmark, JCI carries a lot of weight. It kind of signals world class.
That makes sense. Okay, then there's NABH, National Accreditation Board for Hospitals and Healthcare Providers. That's ours here in India.
Yep, part of the Quality Council of India, set up specifically for our healthcare organizations.
So tailored to Indian needs, setting benchmarks for our industry.
Exactly. And they really emphasize being functionally autonomous.
Why is that autonomy piece so important for NABH?
Well, it's crucial for credibility, isn't it? It means their standards, their processes, they're developed independently.
Not influenced by, say, industry pressure.
Hopefully not, yeah. It means they're tailored for India, for our challenges, our priorities. That independence makes the whole thing more trustworthy for providers and, for the public.
Got it. Okay, who's next? IASQA, International Society for Quality in Healthcare.
Another global one, but a bit different. Not for profit, member-based.
Been around over 30 years, working across, 70 countries, 6 continents? Impressive reach?
Definitely. They focus on promoting quality improvement through education, sharing knowledge.
And this thing called external evaluation, what does that actually mean in practice?
Basically, it's about having an independent body check the quality of healthcare organizations, or even check the accreditation programs themselves.
Like an accreditor for the accreditors?
Kind of, yeah. IASQA might assess if accreditation bodies around the world meet certain international standards for being thorough and credible. It helps keep a global standard for quality checks.
That's a really useful way to put it. Okay, and Supreme Medic Consultancy.
Right, they work directly with the hospitals, helping them plan, get ready for accreditation.
They specifically mention helping with NABH accreditation.
Yeah, they're the ones on the ground, helping organizations navigate what can be a really complex process.
It shows the practical side, doesn't it? It's not just about having standards.
Exactly. It's about implementing them. Consultancies like Supreme Medic provide that know-how, the support to get through the paperwork, the surveys, all of it.
And tying it all together, this whole accreditation framework is seen as vital for improving mental health care quality, too.
Absolutely. Which really drives home that quality isn't just about physical health.
Yeah. Given the specific challenges in mental health care, having a structured system like accreditation seems critical.
It really is. It provides that framework for accountability, for continuous improvement in a field that, let's face it, has often been shortchanged on quality standards.
Okay, so let's dig a bit deeper into the core purpose. JCI, you said measuring, assessing, improving performance, and their international patient safety goals are key.
Very key. They're like the high priority zones.
High priority?
Yeah, areas where things are most likely to go wrong and have serious consequences for patients.
Like what sort of things?
Things like making sure the right patient gets the right treatment, preventing medication mix-ups, cutting down on hospital infections.
Being big risks.
Exactly. By focusing on those specific goals, JCI gives organizations a clear roadmap. Concentrate improvement efforts where they'll make the biggest safety difference.
Right. Focus where it counts most. Okay. NABH, their purpose. Setting benchmarks, meeting Indian consumer needs with that functional autonomy. How does that consumer focus actually shape what they do?
Well, it means their standards aren't just about clinical stuff. They also look at things important to patients and families here in India,
Such as?
like access to information, patient rights, how complaints are handled, things like that.
Really?
By including those, NABH tries to empower patients, make the system more, patient-centered.
Okay, and iSQA, again, promoting quality, recognizing accreditors through external evaluation. Why do we need that international layer looking at the accreditation programs themselves?
Having a body like ISQA involved helps ensure some consistency, right, and rigor across different countries.
So accreditation in one country means something similar to accreditation elsewhere.
That's the goal. It sets a benchmark for accreditation bodies themselves. It builds confidence globally that accredited really means something solid about quality and safety no matter where you are.
It's interesting, these layers of oversight. Now, we heard quotes from hospital leaders about JCI benefits, team building, better coordination,
Competitive edge, community trust.
improved risk management, a culture of patient safety. That's quite a list. Anything jump out at you there?
What really stands out is just how broad those benefits are. It's not just ticking a box.
Right.
People might think it's just a regulatory hurdle, but these leaders are talking about real internal changes, better teamwork, a shared focus on safety.
And the external benefits, too, like reputation.
Exactly. The competitive advantage, the community confidence. It shows quality isn't just clinical, it's strategic, too. It has real business value.
Let's pivot to the process. How does it actually work? For JCI, it's an evaluation against their standards, and they offer resources.
Yeah, they have advisory services, online tools, things to help organizations get ready.
What's the value of having that external evaluation, though, an outside team coming in?
Oh, it's absolutely core to the whole thing. It's an objective look.
Fresh eyes.
Fresh eyes, independent assessment against the standards. They might spot things the internal teams miss. Plus, it gives credibility. It assures the public that the organization really has met these international benchmarks.
Makes sense. And for NABH, we mentioned Supremedic offering implementation and accreditation services. Does that mean it's pretty common for hospitals to get help with this?
Oh, absolutely. Very common. The whole process can be really demanding.
Time, resources.
Loads of time, resources, specific expertise, implementing standards properly, getting ready for the assessment. It's a big job.
So consultants help streamline it.
Yeah, consultancies like Supremedic offer guidance, training, help with the documentation. They know the process inside out. It can definitely boost an organization's chances of getting accredited successfully.
And linking back to mental health, applying these kinds of procedures and standards seems so crucial there.
Yes, absolutely vital, because consistency is key.
How so?
Well, in mental health, having consistent standards helps ensure a baseline of quality and safety everywhere. It gives a framework for tackling really difficult issues.
Like use of restraints?
Exactly. Restraints, privacy, patient rights, huge issues in mental health. Accreditation drives a more standardized, evidence-based approach to handling them.
And JCI uses a continuous model. It's not just a one-off check.
Right, it's not one and done.
Why do that? Why the ongoing requirement?
It reflects reality, doesn't it? Quality improvement isn't a destination, it's a journey. It never stops.
So regular checks keep organizations on their toes.
Pretty much. It requires regular reassessment, continuous effort. It encourages embedding that quality and safety culture into everyday work. It makes sure accreditation stays meaningful over time, not just a snapshot.
Okay, let's talk scope. JCI covers a huge range: patient safety, quality management, infection prevention, meds management, facility safety.
Emergency management, too, is broad.
Why cover so much? Why such a comprehensive approach?
Because healthcare is complex. Patient safety isn't just about one thing. It's loads of interconnected factors.
So you need to look at everything.
You really do. A comprehensive approach stops you from having silos, where maybe the surgery is great, but infection control is weak. You need to address everything: clinical practice, the building itself, management systems, to create a truly safe, high-quality experience.
Okay. NABH then focuses on India, setting benchmarks tailored for us. How might our national standards differ from JCI's international ones? Any examples?
Well, NABH standards might factor in specific Indian regulations or how healthcare is delivered here, maybe differently in cities versus rural areas. They might address specific diseases more common here, or, cultural aspects of how doctors and patients interact. JCI provides the global benchmark, but NABH can give more specific guidance for our system.
And in mental health, the standards mentioned restraint use, environment, human rights, continuity of care, communication, data tracking. These are really sensitive areas.
They absolutely are.
What does highlighting these tell us about accreditation's importance in mental health?
It underscores the critical need to protect people's rights and dignity in mental health care settings. Things like restraints or involuntary treatment are ethically charged.
Need clear rules.
Exactly. Clear standards, clear oversight. And the environment, ensuring care continues smoothly, good communication, these are vital for recovery. And tracking data helps ensure care is based on evidence and allows for monitoring improvement.
So let's circle back to benefits. We heard JCI users mention team building, community confidence. What else? What are the other advantages for an organization?
Beyond those, you often see better efficiency,
Yeah.
smoother operations.
How so?
Well, the process often forces organizations to look closely at their processes, identify bottlenecks, reduce waste, reduce errors. Risk management usually improves too. And often, staff satisfaction goes up. Working in a place committed to quality can be more rewarding.
Better outcomes eventually.
That's the ultimate goal, yeah. Better patient outcomes and a more sustainable organization overall.
And for patients in India, choosing an NABH accredited place, what's the tangible benefit for them?
It offers some assurance, doesn't it? Confidence.
Confidence in the quality?
Confidence in the quality and safety. It signals the facility meets national standards, it's been checked independently, and it's committed to improving. You'd expect a more patient-focused approach, better communication, more focus on your rights and safety.
And Supremedic positions NABH accreditation as good for investments.
Yeah.
Why would investors care about accreditation?
Well, from an investor's view, accreditation is like a stamp of quality and good governance.
Reduces risk.
Reduces risk, exactly.
Yeah.
It enhances the facility's reputation, its long-term viability. Accredited places might attract more patients, maybe better deals with insurance payers.
So better return on investment.
Potentially, yes. It signals commitment to standards, proactive risk management. Investors like that.
Okay, and specifically in mental health, again, maintaining quality, evidence-based care, and reducing stigma. How could accreditation possibly help reduce stigma?
That's an interesting point. By setting clear standards, promoting quality and safety, it helps professionalize the field.
Makes it seem less scary or mysterious.
Perhaps it demonstrates a commitment to providing effective ethical care that can challenge negative stereotypes, build public trust in mental health services, and if people trust the services more, maybe they're more willing to seek help. It could contribute to chipping away at that stigma.
Interesting connection. Finally, ISCA, this global society connecting professionals, improving quality. Their upcoming conference in São Paulo sounds relevant, inclusive health systems. How do groups like ISCA actually push healthcare quality forward globally?
They play a really vital role, actually. They create a global community focused on quality.
A network.
A network, yeah. A
Yes.
platform for sharing what works, disseminating best practices, getting people from different countries and systems, talking and collaborating. Their conferences, journals, initiatives, they raise awareness, encourage new ideas.
And to drive improvement.
And ultimately help drive improvements in how healthcare is delivered everywhere. They keep the global conversation on quality moving forward.
Okay, so wrapping up this deep dive today, it feels really clear that accreditation, whether it's global like JCI or national like NABH, is just,
Well,
it's crucial.
it's a key mechanism, yeah, for setting and keeping those standards for quality and safety.
And it's not static, is it? It's this dynamic thing, assessment, best practices, always trying to improve.
Definitely. And vital not just for general hospitals, but specifically for the unique challenges in mental health facilities.
Absolutely. So for you listening, understanding this whole accreditation framework, it gives you a valuable way to see how healthcare organizations aim for excellence, for accountability.
Yeah, seeing how the international and national efforts link up, the practical steps involved.
Yeah.
It really shows a commitment across the board to making care safer and better.
And maybe it leaves you with some further questions. As you think about these different levels, these organizations, what else are you curious about?
Perhaps the specifics, like what exactly are the standards for, say, an emergency room versus a mental health clinic?
Or maybe the long-term impact. How much difference does accreditation really make to patient outcomes down the line?
Definitely something to think about, maybe look into a bit more on your own.
Well, thanks for diving deep with us today.